Assalamu alaikum. Uh, my name is Shahid Rafiq. I'm APPNA Merit Co-Chair, a neurologist by profession, practicing in Maryland, just north of Washington, D.C. in United States. It's my honor to moderate today's very important topic and a very important guest and panelist here. As you know, we have started with a series of webinars which primarily focusing on, seeing the landscape of research and innovation in healthcare in Pakistan. So obviously, it's a very important topic. We ourselves are learning and we are getting amazed every week with very illustrious speakers and panelists, what everybody is doing. A lot of people are doing a lot of amazing and excellent work, and we didn't know that. And purpose of this webinar was for the APNA membership in general, in particular, and also Pakistani healthcare diaspora in general, to make them aware of all these opportunities, all these exciting development that are ongoing in Pakistan, and if they would like to participate in academically or just joining hands or lending their expertise, lending their time, and also maybe down the road any investment, because whatever you do in Pakistan, it's a great service to Pakistan. And all of us, I think we have common um, goal of elevating healthcare and research in Pakistan. And what better way to focus on healthcare innovation and research as a clinical trial as a focus, because as you know, research is a really, really, really broad topic, and what we are focusing on is the clinical trials as well as the innovation in healthcare. And at the end of the year in December, inshallah, we will have a physical um, in-person meeting. Hopefully, by that time, we would be allowed to and able to do that. And so I'm sorry, I'm sitting outside, and if there's a background noise, I came to the hospital for round, and sorry for this background noise. Um, basically, this is our focus of all the, and so in December, hopefully we will have a in-person conference with HEC, with Dr. Bhutta's help, with Dr. Zain's help, uh, and uh, and we planned it earlier, but with the COVID situation ever changing, hopefully we are hoping by December Pakistan will be in a better position, inshallah, and most people will be vaccinated, as are being vaccinated in North America, Canada, and US. So with that ray of hope, we start today's program. And I would like to invite our speaker, Dr. Zain-ul-Abdin, who is Director General Research and Innovation Wing in Higher Education Commission, HEC. Zain-ul-Abdin holds a PhD in Computer Science and Engineering from Sweden, with a specialization in high performance embedded computing. During his 20 plus year of experience in industry and academia, he has played a key role in a number of research projects such as smart multi-core embedded system, um, high performance embedded computing, and towards next generation embedded systems. He has worked in close collaboration with Swedish Defense Research Agency and industrial partners such as ST Microelectronics, Ericsson, Adapteva, and Saab in their projects. Uh, in the past, he has served as associate professor at Hampstead University, Sweden, and director at Telesehet Private Limited, Pakistan. Currently, as I mentioned, he's leading the research and innovation wing of Higher Education Commission, where he has spearheaded a number of reforms to orient the research programs towards producing socioeconomic impact. And that's the topic of his talk today, to shed light on what the Higher Education Commission is doing, and what are the opportunities for not only Pakistan, but in particular the healthcare Pakistani diaspora across the globe, and in particular in North America, US and Canada. So Dr. Abedin, please go ahead.
Thank you so much, Dr. Shahid. So first of all, belated Eid Mubarak to all the attendees and the panelists as well. I've prepared a short presentation, which I thought that would be better to share with you actually. Let's see. I hope everyone can see my screen. Yeah. Okay. So what I'll try to capture during the next 25 to 30 minutes is a kind of an overview of the research reform initiatives that we have been undertaking during the last couple of years. And then I'll let Dr. Zulfa Bhota, who has been working with us as a chair for our biological and health sciences panel, actually, to reflect on some of the more insights into the healthcare domain that he has experienced during the last year or so, actually. So let me first try to introduce some of the challenges, actually, that are typically overlapping both the quality of higher education as well as the quality and relevance of our academic research, actually. We are also facing a number of challenges related to the quality of academic governance. And of course, you might be familiar with some of those things, but I'll try to point some of the most things that we are currently facing. Then another issue, which kind of is a related problem to not only the academic part, but also typically to the research part, actually. And that's the level and predictability of the government funding, actually. You might be aware that during the last couple of years, the funding to HEC, and of course, since HEC is one of the major funding body for the higher education institutions, as well as the research funding body, actually. So that has also reduced significantly during the last couple of years. Then another problem that we are facing currently is the weak institutional autonomy, and as well as interference from external elements, actually, which kind of results in making inconsistent policies, as well as ad hoc decision making, actually, which leads to a number of other issues that one can find in the ecosystem that is existing currently, actually. So what we have tried is to actually, let me just give you another figure related to some of the quality on problems, quality related problems in the research domain that we are facing. So for instance, we have one of the flagship program, which is called National Research Program for Universities, NRPU, that has been ongoing for the last 17 years, actually. And if you talk about the amount of funding that we have provided through that program, it's slightly less than 11 billion rupees, actually. And to be honest, if I give you a figure of how many projects that we have provided this amount of funding, so it's around 600 projects, actually. That means that on average, we are funding between 2 to 3 million rupees per project, actually. And I mean, since you are right now sitting in North America, so you can very well imagine how much, whether we can really produce any significant results with that amount of funding, actually. And if you look at our neighboring countries, comparison actually. So we are kind of very at the bottom in terms of funding actually that is going into the R&D initiatives. Then another problem that we have is that first of all, we haven't done any major exercise of impact assessment of that, even that amount of research funding during the last 18 years or so. As a result of that, we have also seen that most of the research that we were producing, it has resulted in increased number of publications, which of course we can claim credit for that. But overall, it has not produced any significant impact on the industry, on the other socio-economic factors, or even resulted into some kind of a policy initiatives that can result in improving the governance within Pakistan. Another issue that I am also responsible for is actually the quality systems for our journals that we recognize at HEC, in which actually most of our academics are publishing their papers. So we did an exercise almost 1.5 years ago actually, and we found out that only 15% of the journals that we were recognizing, I'm saying about the national level journals, not the international. So they were meeting the minimum level of international standards actually. And these journals, some of them were existing for more than 2 decades or so actually. And gradually their quality was also declining actually. We have also been facing a number of problems related to plagiarism and of course bypassing of standards. And of course that's another element that kind of indicates some kind of ethical issues within the academic system as well. But when we started this journey, so we focused on that we would try to orient our research for impact actually. And in order to undertake that mission, we have taken a number of steps towards that. I'll highlight some of the major ones that we have been undergoing actually during the last few years. And the major ones are introducing a new research grants framework, and then constituting these scientific review panels. We have also revised the policy for the journals evaluation. And then we also embarked on a journey to define the national research agenda actually, and I'll give you some insights into that as well. So some of the things that are already in the implementation phase are these bigger research grant programs, the GCF, LCF, TTSF, and another initiative that is more oriented towards entrepreneurship actually, in which we will support our academics, be it the students or the researchers, to get some kind of a seed funding to launch a new startup if they really have an innovative idea actually. And then since we have also a number of Center for Advanced Studies and Center of Excellence that are existing in Pakistan, and some of those are old as much as 40 to 45 years old actually. So we have also developed a model so that their funding is also linked to some kind of a results, so that we can kind of divert them to produce some more meaningful research as well. So let me just start from this overarching research grants framework. So if you look at this landscape of research grants, we have divided that into 4 blocks. On the left-hand side, we have the applied research and basic research. And then on the top, we have unsolicited research and targeted research. Our previously ongoing program that was this National Research Program for universities, we have revamped that program as well, actually. But we have still considered that as a part of our unsolicited research. So any researcher can actually pitch any research idea, and if it gets through our review system, we will be able to fund that program. The only thing that we have said is that we will reserve part of the funding for basic research, and then partly it will go to support applied research. All of the other major initiatives that we are right now implementing, they are primarily looking at the strategic research and targeted research. So the biggest program is called GCF, the Grand Challenge Fund. I'll go into more details about these programs later on. And then we have a program called Local Challenge Fund. We have another program which is typically looking at industry academia linkages and promoting the collaboration between industry and academia. That's called this Technology Transfer Support Fund. And then we have kind of a bilateral program with British Council, actually, where we are funding the academic contribution from Pakistan, whereas British Council is covering the cost for the UK partners as well. So let me just give you some brief highlights about each one of these programs. NRPU has a funding limit of 20 million rupees. And then we also have kind of put a condition that what we would like to see at the end of the project is that it should produce some kind of a demonstration of strategic relevance to the Pakistani industry or society. So typically the projects that we have been funding are of a maximum duration of 3 years, and we expect that we will fund at least 100 projects during the year, actually. Then this biggest program, which we call Grand Challenge Fund, this has a grant value of around 1.5 million US dollar, actually. And the main emphasis for this program is to promote and stimulate collaborative and interdisciplinary or even multidisciplinary research, actually. So this is a consortium-based branch, actually, where different universities can collaborate to produce a certain outcome, actually, and we will be able to support that kind of initiative, actually. What we have done here is that we have identified 32 research intensive universities within Pakistan, and then these research intensive universities will be the lead partner in this program, actually. But then they can collaborate with other non-research intensive universities or even research intensive universities as well, actually. And even they can join hands with other R&D organizations or even private sector as well. And what we have also encouraged is that they can even include international partners within their team as well, actually. So I hope that some of you, if you want to participate in these initiatives in the future, you will be very much inclined to do that, actually. What we have identified is that we have identified some of the major strategic priority areas, and these are again broader themes which cover kind of the, you can say, the major national level challenges that we are facing in Pakistan. But then what we have done is that we have actually done a very rigorous exercise of collecting more granular themes within these broader themes, actually, and I'll present you some of the process that we have adopted there later on actually. Then we have the Local Challenge Fund. Here, this program is focused towards universities which can actually produce research results which are locally relevant to within their district or divisional level actually. So typically what we are asking our academics is that they can come up with research ideas related to these 17 sustainable development goals, but then they should also take on board their local administration and maybe the local private sector participants as well actually, in order to present a solution to that problem actually. And if we found out that this is the kind of best results that, or idea that they pitched, so we will be hopefully able to fund that project as well. This has a funding limit of around $700K US. I have already mentioned the ICRG program. This was the initiative that we started with our colleagues from the British Council. It has a funding limit of around $0.3 million US for the Pakistani participant, but then there's the equivalent of the same amount for the British partners as well. Actually, we have identified some themes here together with our counterparts from the British Council, and we have already funded. We were expected to fund 6 projects actually, but when we did our review, so we found 8 projects that were good enough actually. So finally, we decided to fund all 8 of them actually for this particular program. Then we have the Technology Transfer Support Fund, and here the main idea was to promote collaboration between the industry and academia. And in order to ensure that we are actually kind of really making sure that the industrial partner is committed to that particular project actually. What we are doing is that we are requiring that each industrial partner will have to fund at least 50% of the funding that we will provide from the HEC actually. And that funding can be either in kind or in cash actually. And we have a funding maximum project duration for these projects up to 2 years. And we have actually just recently concluded the funding round for this particular program, and we have funded 17 projects out of these. In all of these programs, we are very much encouraging female participation actually, and especially if there are people within your team from the female representation actually, that will be very much appreciated. Then we have also instituted another initiative which we call university-led research. And this is something which is primarily intended for the public sector universities. And the idea there was that we should incentivize our public sector universities in order to establish and co-fund their own research programs. And in order to do that, what we will be doing is that if a public sector university, let's say, puts 25% of the funding in any one of these initiatives, we will provide the rest of the 75% funding actually as a matching grant to support that initiative. And this again has been ongoing for the last 1 year or so actually. And here we have mainly divided it into a number of you can say sub programs or so, in some of which are going to support the recently fresh faculty members and people who are going towards presenting their conference or seminar papers abroad, and even if they are planning to hold a symposium or a conference in Pakistan actually. So this grant is also supposed to fund that part as well. And of course, the access to the digital resources, lab resources, and even graduate student research will also be supported through this initiative. Now, the next part that we have also worked on was that we have these major research initiatives or the major funding grants that are already being launched actually. But we also felt the need that we need to revive our assessment system as well actually. Because when we looked at the previous program's history actually, we were not very much satisfied with the results, not only in terms of the expected results, but the kind of projects that were funded actually in those rounds. So we again launched this kind of initiative in order to constitute these high-level scientific review panels actually. And the main objective of these panels was to ensure the quality of assessment, transparency of our systems, objectivity during the assessment, and also efficiency actually. I don't know how much familiar you are with the HEC's previous systems actually. In some cases, we have taken years to actually complete the overall award process actually. So, that one of the major kind of requirement or intention for us was to ensure that we would like to also achieve kind of timelines within the award processes as well. So what we did was that we actually constituted these panels on 8 of these broader domains actually. And you can see that the biological and health sciences is one of those domains which Dr. Zulfikar is the chair actually. But then there are panels related to almost all the domains that one can think about. So these are the chairs for other panels, but at the same time, we have also constituted these kind of program chairs as well, actually. So for instance, for the Global Challenge Fund, we have appointed Dr. Athar Osama, who has been the former member SNT of Planning Commission. Then for the Local Challenge Fund, we have appointed Dr. Rashid Bajwa, who is currently the CEO of the National Rural Support Program, which is one of the biggest research rural support program in Pakistan, actually. And then for TTSF and NRPU, I am actually taking charge of those programs. So what we did was that there are programs which are more discipline specific, but then there are programs which are more of multidisciplinary nature actually. So in those multidisciplinary programs, sometimes our applications, grant applications, they will go to multiple panels actually, and we will get reviews from each one of the panels, and finally we decide on whether that proposal is good enough to be funded or not actually. And there are different layers of assessments involving the panel and program chairs, then the panel members, and then even the external reviewers. And then we had these panel meetings which actually conduct the reviews and then finally decide the actual award process. So another thing that we have developed during the last 1.5 years was to have an online system for managing all these research grants actually. Previously, we had a kind of an ad hoc system where sometimes we do get the applications online, but then we had a requirement to also send or to receive hard copies of the documents as well actually. But during the last 1.5 years or so, we have totally eliminated any need for submitting any paper copy of any document to us actually. All of the initial applications are submitted at this particular portal actually, and then all the review process is being managed through this system actually. And then right now we have also developed post-award stages for managing the execution of the projects through this system as well. This has also enabled us to gather a lot of data actually, that now we are looking to do more data mining in order to determine actually the quality of our reviews, and also to see actually sometimes even the quality of our reviewers as well actually, because that's also a thing which is we are very much concerned about it. The next thing that we embarked on was to also develop a journals recognition framework as well. And what we did was that we established kind of a minimum standards for publications quality actually. And based on our revised policy, we recognized Web of Science and Scopus as the indexing agencies in which all of our journals that we will recognize in the W and X category, they will have to be indexed in these two indexing agencies actually. But then on top of that, we have actually identified these scientific quality parameters actually. So these are 6 parameters. 3 of them are obtained from Scopus, 2 from Web of Science, and 1 from SkyMago actually. And based on weightage average of these parameters, we determine kind of a score of each journal, and then they are categorized in the W, X, and Y category. The W is the highest or the best journals category. So again, this system is an online system actually. Anybody can go to this web link and they can see which journals HEC is recognizing currently. Then we have also created a category which is the lowest category actually, why, in which we are also recognizing our local journals, especially the national level journals, which currently are not indexed in either Web of Science or Scopus, but we do process them through our local committee actually. Then I've also mentioned about this initiative of National Research Agenda actually. When we developed this framework, grants framework actually, we presented this to the Prime Minister, and we have requested the Prime Minister at that time that they should direct the different ministries and different, even the autonomous R&D organizations, that they should contribute in identifying their own research problems actually, or research topics. And we were glad that there was a directive issued from the Prime Minister office, and we received a lot of information from different ministries. But finally, what we did was that we conducted a research prioritization exercise, and here I'm just focusing on the health-related research actually, which Dr. Zulfikar was kind enough to lead. And he also introduced us about this process that was recommended by WHO actually. So we conducted this research prioritization exercise over a couple of months between December until February actually. And then we identified these 6 areas within which we asked for a number of research questions actually. And then we sent around to different academics and even researchers in the national health landscape actually, to get their input about categorizing them into different priority, high priority, low, medium, and then low priority. And finally, based on that exercise, we have now come forward with high priority sub-themes actually that are now part of our research programs that we have launched recently. Now, another thing that we are focusing is to now create a broader ownership of this research agenda and also kind of advocate based on these things, some kind of enhanced research funding actually that we would like to undertake in collaboration with other research funding bodies. Just to inform you that there are other bodies such as Pakistan Science Foundation, even we have Pakistan Health Research Council as well as, and PARC, and even some other ICT related funding bodies as well. Finally, I will just give you a glimpse of this research performance based funding model that we have recently introduced for the Center of Excellence. And the main idea behind that initiative was to kind of try to quantify their performance, which can be linked to their annual funding. Just to inform you that we have in Pakistan around 38 research centers that are being funded through HEC through the recurring grant actually. But then in addition to that, there are around 10 other research centers which are funded through different other mechanisms like PSDP funding, and even some of them were funded through donors funding as well. So in this research funding model, what we have done is to kind of identify some of these broader activities like knowledge products, publications, R&D, networking events, and then patents and honors and awards. And then each one of these centers will be kind of committing to us that they are going to target these kind of things annually in order to receive funding from HEC actually. And then at the end of that year, we are going to evaluate some of these things that they are going to submit. And based on that evaluation, we will be determining their funding requirements for the following years. So it's a kind of a lag model that we have implemented. And we have tried to cover all the broader things or subcategories that could be relevant to all of these major centers. So just to inform you that these centers are not only limited to science disciplines, there are centers which are conducting more like area study centers, or even things related to social sciences as well. So then we have also tried to cover all the things related to publications, which includes journals, conference, books, chapters, theses, and even book reviews. And previously, all of these centers, they didn't have any dedicated funding for even conducting these kinds of networking events actually. So now we have also included that, so that if they conduct these seminars or exhibitions or conferences or workshops, they will be getting some kind of additional incentive for that as well. And finally, if they achieve some patents or honors or awards, so again, they will be getting some kind of a reward for that as well. So I think I'll stop here, and I'll request Dr. Zulfikar Bhutta to shed some light on some of the healthcare research that we have funded during the last year.
Thank you, Zain. Thank you very much for that excellent overview. Actually, it is a fantastic encapsulation of what the Higher Education Commission has done. So let me start by paraphrasing to say that this was not and is not my first experience of the Higher Education Commission. I actually oversaw some of the health science research portfolio at the Higher Education Commission about 20 years ago, when General Musharraf first established the Higher Education Commission. So I've had a chance over the years to see what has changed over time and what the Higher Education Commission has been able to establish. So I'd like to really credit the HEC and Zain in particular with laying down the infrastructure on which a lot of various research hierarchies could function. So you could go from just university-specific research to research which has also got links to technology transfer, to scaling up, grand challenges, as well as local challenges. So there's no shortage of ideas. And although Zain is right in that overall investment envelope may still be lower than many of the contemporary regional countries, but it's substantial. It's I mean, 11 billion is still substantial amount of money compared to 20 years ago. And therefore, one has to look back and say what's been achieved with that investment, even if universities have received no more than $30,000, $40,000, $50,000 per project. Is there much to show for it? And I think the glass is about half full there. So our own assessment in terms of capacities is that there is probably a lot of infrastructure now for research, laboratories, equipment, maybe even some research active faculty. But by and large, the issue that we face in research in many of our higher education centers, just very broad strokes, with the exception of a few centers of excellence, is that there isn't sufficient capacity, either for oversight of research, or as exemplified with one thing that Zain did not touch, is in the review process of research. We're very dependent upon local professionals in universities or academia for evaluation of research proposals. And that's been a nightmare, at least in my tenure, to find people who are willing to do or are able to do good quality reviews. That's one of the reasons why we persuaded the HEC to allow us to reach out to the diaspora here in North America or in Europe to see how they could assist in that review process. But principally, review processes are local. So we need to expend a lot of effort and time on boosting those capacities. The reason I raise this is that's also linked to the quality of researchers. So research oversight in universities is very intimately tied to the ability to evaluate, just like you can assess the research capacity of any organization by what it does with its journal clubs, its ability to parse the information, to evaluate and analyze information. Similarly, the review process is pretty critical to a fair and an appropriate merit-based assessment of research. So we need to do some work on it. But as I said, it's a glass half full. So there is money there for good quality researchers to put forward good proposals and to execute them and to be evaluated on that basis. So one thing that, inshallah, if Zain gets an opportunity that we want to do over the next couple of years within at least the health sciences portfolio that I lead, is to do an impact assessment of what have we invested in and what has it led to. And if we do that, the Higher Education Commission will be much better served. Now, Zain asked me to talk about health research. Broadly speaking, although I haven't got a slide showing this, but I can tell you off the top of my head that most of the research proposals that we receive on the basic science are related to decent questions on mechanisms, mechanistic research, but oftentimes is not necessarily tied to a clinical problem of relevance or priority to the country. That's one of the reasons why we undertook this research prioritization exercise. That if you want to look at a certain receptor, or if you want to look at a certain mechanism in terms of its relevance to Pakistan, then it has to be tied to a public health problem or a clinical problem. And I hope we are moving in that direction. On the applied side, many of the proposals that we receive are still fairly basic. The so-called Me Too type of research, I want to do the same and it's been done before. They're generally not accompanied by a good systematic review of what is already available and known about it, if not globally, locally. And that's a very useful starting point. And thirdly, it does not have enough national collaboration. So we found people who've are very keen to have international collaborations, and that's always encouraged. But more so, what we would like to see is more national collaborations between centers that are a little better off, for example, in genomics and in biomedical research, who can support some of the upcoming universities in health sciences. Well, be that as it may, my own experience of the research prioritization exercise that we completed in January, February this year was overall positive. We were able to find people who are willing to give time, to give enough thought processes into what they would like to see as priority areas of research. And although we may have ended up with more than what we wanted, there is still material there that could allow us to hone in the future on what kind of research is of meaningful nature and priority in Pakistan. The second thing that we were able to accomplish is multidisciplinary research. So there's a lot in there that allows you to think of what can be done between health sciences, agriculture sciences, for example, other disciplines, One Health, surveillance, and also what kind of statistical analytical capacities can serve more than one sector. So what we need when the pandemic is over is a national consultation or a national moot where we bring people interested in health research together. And on the health side, get people thinking on what can be done with indigenous resources, internal capacities. Within that, how can we prioritize things that are meaningful for the country? I'll give you one example. When COVID hit, and Zain and HEC leadership decided to establish a very fast-track mechanism for meaningful research around COVID diagnostics and interventions, we really had to struggle because not a lot of innovative, practical ideas came forward. And as a result, not a lot could be funded that could be fast-tracked at a time of great national need. And that's when I thought we would really need to do much better in terms of preparedness in the future. As I close, I do want to say something about the general health research milieu in Pakistan, because I'm sure some of you may ask the question, well, what about other organizations? How come this is only the Higher Education Commission that is looking at this? There is also the Ministry of Science and Technology and the Ministry of Health, under which the Pakistan Medical Research Council used to exist for a very long time. Well, some of you may not know, the Medical Research Council became the Health Research Council post-devolution. For a number of years was inactive. At one stage was even housed in the Cabinet Secretariat because the Health Ministry did not exist, but has now, through the NIH ordinance that was implemented in December or executed in December by the President, under the new National Institutes of Health, there will be an Institute for Health Research, and the Pakistan Health Research Council will be integrated within that. Now, what that means is that at an oversight level for health research, particularly when it relates to clinical and public health research, we will have an umbrella body that is housed firmly within the National Institutes of Health with its own budget, not as a program or a project grant every year that for years on end used to be the lot of PMRC. But with a permanence, a firm constitutionally supported autonomous status and resources. So I am, fortunately for my sins, the chair of the Board of Governors of the National Institutes of Health. So one of my tasks is to make sure that we establish the Health Research Council and the Institute concurrently with a lot of the health sciences research integrated within it. And a very important part of that that will have to happen is a very close liaison with the Higher Education Commission, so that we are not duplicating, but we are collaborating in terms of joint funded projects and projects that require both our universities as well as our public health institutions to move forward. Last point, as happens in most countries, there are never internal resources sufficient for the kind of high-level research that is needed in health. Those are always internationally competed. So there are research funding bodies that will fund research within Pakistan and have done for years. And they range from bilaterals like the British government, USAID, the bank, to science funding bodies that are more generic, like the National Institutes of Health, NIH, USA, Wellcome Trust, MRC, UK. And there are substantial grants related to those that flow into universities in Pakistan, at least those who compete for them. And there are many centers that have benefited. I mean, you know, at my own parent university, the Aga Khan University, almost 80–90% of the research funds that flow in come from such organizations, the World Health Organization and other funding bodies, not from the traditional internal sectors, because they just can't compete with the quantum of funding. So I think what we also need to encourage within Pakistan, both the public and private sector universities compete for, is those international resources which are there, and they have grown over the years. Many of them now will directly fund low and middle income country universities or academic bodies. They don't have to go through a center based in either North America or UK or Europe. And that is clearly a future possibility that we could enhance the quality of research in the country to the extent that people from all over the place can compete for those grants. And I know that several do. So I'll stop at this stage. I'll be happy to take questions along with Zain as we move along. Thank you very much for that excellent presentation, Zain. Really very good overview.
Thank you, Dr. Bhutta. It was very informative. I, in particular, was interested after Zain's excellent presentation to listen to you, and thank you for that. Dr. Bhutta, as many of the panelists and of course some attendees would know, is the distinguished university professor and founding director of global health in his parent university, Aga Khan, as well as with the Sikh kid in Toronto, and hold many portfolios, including being the health science director in HEC research, as well as the Prime Minister Health Task Force, member of that task force. But I would like to now invite other panelists also, and I also apologize that today I was on call and I didn't expect that as the call happens, it got really busy and hot recently. So, but I didn't want to miss this important topic myself. But I'll request Syed Uzair to please take over if I have to go in a moment. But I'll ask our research subcommittee chair, Professor Mustafa Siddiqui, at this point to please give your comment and question for the speaker or Dr. Bhutta, and then we'll go to the other panelists and then question and answer. Thank you. Mustafa, please unmute yourself.
Assalamualaikum. मैं sorry, caught at the wrong time. मैं बेटी को vaccination कराने आया हूँ. It was a wonderful presentation. Thank you, Dr. Zain and Dr. Bhutta. A few of the things I was hearing Dr. Bhutta about the review and how you can ask me. So we are trying to make a database of all concerned. That means people who specialize in those areas, and to ask them of their willingness to contribute their time as well as help in reviewing, as well as we have discussed ideas like a Shark Tank, where people who come to the left, who can come and present their ideas, and then either there can be an intellectual feedback, or there can be if there is a thing where we can have a collaboration that can happen at that time. So, but thank you very much for all this, and we'll follow up on these recommendations and further contact.
Thank you. That'll be very helpful.
So, yeah, go ahead.
No, Uzair, are you going to coordinate? That's what I meant. I mean, I think we've lost our host. So
No, I'm sorry. Unfortunately, yes, unfortunately, he had to take that call. But I think you are in a better position really to take the question and then coordinate with Zain to answer to those questions.
how do you want us to do this? Shall I just look at the chat, or are people going to ask? Okay.
Yes, you can.
So just quickly looking at the chat, let me pull that out and expand it so I can see it clearly. A number of questions have been asked, and I will start in no particular order, except to say that I do agree with the comments here that people have made on the enormous opportunity for research in Pakistan, particularly in rural areas. So this is a comment made to all panelists. And this ranges from epidemiological research to interventions and what have you. So particularly for the North American diaspora, those who are involved and interested in research, I think this is a great opportunity of linking with your favored or your alma maters and seeing if you can encourage research to particularly focus on problems of rural populations. I do almost 100% of my work in rural populations, for example, and I can tell you there is no shortage of research financing or funding for good projects. But Zain, over to you. How do we encourage people to work on the problems of the poor?
I think, I mean, as far as we are concerned, actually, so any issues, especially, I mean, when you talk about this local challenge fund, actually, there we are typically looking at remote districts, actually. And if we really have something tangible or some idea that can really help in overcoming some of these health-related issues in those smaller districts, actually, that we'll be very glad to consider them in the local challenge fund program. There again, as just to inform you that in the local challenge fund, we are not focusing on maybe very top or blue sky kind of a research, actually. Rather, we are more interested in innovative ideas which can actually really solve some of those problems. So I think if you have some of those ideas with you, you can really collaborate with universities which are located in those districts, actually, and you can pitch your ideas to HEC. We'll be very glad to consider them.
So there is a question on somebody who's interested in dental health research and how can they work on a trial. There is also a linked question on socioeconomic impact of the same. And my answer to that is find yourself a partner. It is much better for you to link with a national body, either a dental, and I can tell you certainly some of the best projects that we receive are from dental schools, actually, in Punjab and elsewhere. So link up with some of them, public sector, in the private sector, many organizations. Altamaj, for example, in Karachi is very much engaged in research. Find yourself a partner if you're not directly linked to a university in Pakistan, and apply, and you will more often than not find very willing people. I know that Dr. Noor Butt was on the list here, and he wanted to say a few things. While I look through the questions, Dr. Noor, if you're listening, this is the time maybe you can make some comments. Is it possible for people to unmute Dr. Noor? And then I have a hand up from Dr. Zafar Hayat. Maybe Dr. Saab, you can make your question. Uzair, are people able to unmute themselves and speak, or are we limited to?
I think so, because if the host has changed, given the permission, they can do so. But in the meanwhile, there is some question or comment from Dr. Sarwat Hussain. So may I request Dr. Sarwat to ask, please? Dr. Sarwat, just go ahead.
Ji, Assalamu alaikum, Bhutta Sahab. Again, nice to see you, mashallah.
My God, you're looking as young as ever, Sarwat. Nothing changes. You and I have to have a bilateral conversation.
Now, my question actually is to do with the quality of quality consciousness in healthcare, which is a big elephant in the room, and overarching. It's actually qualities, you can say, the canvas on which the story of healthcare should be written. And I am very interested in bringing healthcare quality improvement in Pakistan, even though that there are the healthcare commissions, and I'm not really certain as to whether their impact on, especially in the rural health, has been any positive. So my question to Bhutta Sahab and to Zain Sahab is, and I saw the list of projects. There was a quality in healthcare as well. What is the priority of improving healthcare quality in Pakistan, which is, has been on the headlines, lack thereof, for a very long time? So I'm going to mute myself now, Bhutta Sahab.
So let me answer that, and Zain, please feel free to chip in. So this is principally a responsibility of the Ministry of Health Services, Regulation and Coordination, Healthcare Quality and Delivery. So I can tell you there's a lot of interest in this, and a lot of interest in metrics. Generally, we have in the past, as Sarwat, you know well, measured healthcare quality through hard metrics of things like survival, mortality. For decades, our measure of healthcare quality for women and children has been maternal mortality rates, child mortality rates. We are now in a situation where we believe, while that is important and it's a very hard measure, but there are other things that we absolutely need to bring in, such as quality of care dimensions in facilities. Those of you who have been watching the disaster that's unfolding and is underway in India would recognize how much of an issue that is really right now. I mean, people have been very concerned with not only the extent of the response, but the fact that people had to really run from pillar to post because they were left to their own devices. अगर आप उसको पाकिस्तान के कोविड रिस्पांस से कंपेयर करें तो अल्लाह का बड़ा फजल है. Even in the public sector with limited resources, we have not seen that, even at the peak of times when there were problems. So the government is very, very conscious of the importance of healthcare quality, particularly in the less well-to-do areas, district headquarter hospitals, rural hospitals, not necessarily within just urban settings. And many of our hospitals work under extreme pressures, extreme limited resources, and they do a reasonable job. So we need a metric, we need measures. Those measures, Sarwat, can range from things like delays, estimation of delays, estimation of morbidity, and as you very well recognize, iatrogenic complications. So that metric is being is universally used. There are a couple of initiatives in terms of doing that from the Ministry of Health. When Zafar Mirza was the minister, he had initiated that because he came from that background. He came from a health systems background at WHO. And we will ensure that continues. I know that in our Prime Minister's task force, that's quite a big issue. And unfortunately, COVID has just sucked all the oxygen out of the rooms these days. But once we are back to an even keel, we will be looking at those altogether. But is this?
Bhutta Sahab, I'm sorry to interrupt you, but one of the biggest issue in my mind is that all the parameters of the healthcare commissions are in English, and majority of our healthcare personnel either don't understand English or they pretend to understand English. Even some of the faculty, let alone the nurses and the other people. And the people on the ground in the wards are the nurses, and for them to be able to conceptualize quality, some of the literature, actually much of the literature, should be translated into Urdu, because to teach them English to the degree they understand healthcare quality concepts is going to take a very long time. So I'm actually, in fact, thinking of translating all the quality parameters and quality literature into Urdu so that our nurses and other people can understand.
That's a great initiative. You should do it. But I should tell you also, Sarvat, के जो frontline workers हैं, जैसे लेडी हेल्थ वर्कर्स हैं और जो के काम कर रहे हैं प्राइमरी केयर पे, उनके तमाम मैनुअल्स लोकल लैंग्वेजेस में उर्दू में, या देयर इज ओनली वन अदर लोकल लैंग्वेज दैट वी यूज इन पाकिस्तान फॉर प्राइमरी केयर ट्रेनिंग व्हिच इज सिंधी. In all other provinces it's in Urdu, but please absolutely do this. I will check also ke primary care level pe kaun se instructional manuals hain jo ke Urdu mein nahi hai. Mere hisab se primary care pe sare Urdu mein hai. But it's a definite worthwhile point to raise. There are a couple of other questions before I go there. Zain, do you have anything to add?
I mean, just to also link to this translation thing that Dr. Saab has mentioned. So, in fact, we were also planning to launch another program, which was to actually give some kind of an incentive to our local journals to publish some of their findings in Urdu language as well. Actually. So just to, we will try to find out the appropriate way for that as well, actually. But that was something that we are planning to launch in the future as well.
Yes, I mean, I think agar my Prime Minister ka bus chale, to everything should be in Urdu. But you know, it's not possible at this stage, just given the state of science and state of translation services. There are a couple of questions. So Shahid Saab, how much you are back? So why don't you kindly take over the moderation? I was just looking at the chat and doing it, and also tell us how much time do we have left? I mean, I lost track. There are 7 minutes over our original stipulated time. Dr. Shahid Rafiq, is he on? Yeah. Sorry, connection आपका मेरा ख्याल में ठीक नहीं है.
Yes.
Can't hear you.
10 minutes more because we maybe take a few questions. Can you hear me?
Yes, I think video आपने बंद किया, so we can hear you now.
Oh.
Please continue.
Please, why don't you go ahead? Yeah.
नहीं आपकी आवाज आ रही है, वीडियो नहीं है आपका, but please just let's take the couple of questions that you said. जी.
मैं एक सवाल पूछ सकता हूँ? I'm back, बेटी की वैक्सीनेशन हो रही है, तो sorry about that. तो मेरा एक क्वेश्चन ये था कि one of the first.
Okay.
Sorry.
Can you hear me?
Yes.
Yeah. I'm sorry that I was in and out. I think we can take one of. Okay. So I think
शायद साहब आपकी आवाज ब्रेक हो रही है.
Doctor.
आपकी आवाज ब्रेक हो रही है. We can't hear. But why don't we let Mustafa speak? Mustafa, आपका सवाल कंप्लीट कर लें आप.
जी शायद I'm going to ask a question. So
मेरा ख्याल है बिट्वा आप भी
तो
बात करें तो फिर ज़्यादा बेहतर सुनाई देगी.
अच्छा, तो इसमें मेरा सवाल ये था कि one of the first steps in all research projects is having data, and मैं देख रहा था हम यहाँ पर we use a thing called RedCap, which is a free database available for any institution which is interested. I saw Aga Khan and 2 or 3 more institutions in that. So at an HEC level, can that be something which HEC can provide to other institutions that can have a directory of researchers as well as any project like preliminary data on tuberculosis or whatever? And any comments on that?
डॉक्टर साहब, ट्यूबरक्लोसिस पे तो बहुत काम हुआ है, and not just Aga Khan, many other universities have also contributed, from modern diagnostics to epidemiology to antimicrobial resistance. I will give you a name. I mean, I think Rumina Hassan is considered a global authority and the national authority on TB. in Pakistan alongside a few others. So you're most welcome to contact her directly. मैं आपको उनका contact भिजवा दूंगा. I mean, this is typically for most areas. There is almost always one expert or two somewhere who have international standing and a lot of work themselves. So in other disciplines also the same. There are people who are dengue experts in Pakistan. Hepatitis पे काफी काम हो रहा है. And also COVID की वजह से there are many who have emerged who have done a fair amount of modeling work and epidemiological work. So हमारा सबसे बड़ा मसला ये है कि हमारे connectivity nahi hai. We don't have good networks, and we are not able to, with well-meaning people like yourselves, connect you to the right groups in Pakistan, which I think we can do much better on. So I'll request Zain as part of what's been recommended here. I think it's a great offer if we can get a list of people who are interested to volunteer their time as reviewers. They potentially could also be investigators in the future in partnership with other universities. So in tamam meetings का एक बड़ा फायदा ये भी होता है कि we develop the networks and the connectivity to make things happen. I'll be very happy to facilitate that in any which way, since I have 1 foot here and 1 foot in Pakistan. But creating a database of research active Pakistanis across the world, North America, UK, European Union, Australia, New Zealand, even parts of Asia, Southeast Asia, China would be a big priority. I mean, अभी Zain आपको बताएंगे, जरा थोड़ा सा Chinese research project का बताइए, CPEC का, Zain.
Yes, so that's another initiative that we have right now in the review phase actually, and that's around the CPEC initiative, and it's a kind of a bilateral program which we have launched together with the Chinese Academy of Higher Education actually. So there we have again identified some universities within Pakistan, and then I think there are 15 of these in China actually who can be eligible to participate in that program. And right now we have got applications around more than 220 or so actually, and which we are reviewing right now. But these are the kind of programs that we want to initiate, not only with, I mean, China is, we have already initiated, but we are in discussion with other agencies, USAID is one of them actually. Then we are also talking with European Commission and even the German DFG research funding body as well actually, to initiate some kind of these kind of a bilateral programs so that we can really, I mean, with these kind of interactions, we can encourage our researchers to build more strong relationship with these diaspora and even the researchers within these advanced countries. And I mean, through these links, you can even actually open up the possibilities of then competing for funding within their own countries as well. So this is some kind of us, you can say, side advantage of these kinds of bilateral programs.
So I know we are probably coming to the end of our stipulated time, but I want to make a couple of suggestions, and then I'll answer Mehreen's question on the impact assessment of research. So suggestion is to Shahid and Mustafa, and maybe Uzair, you can help put this together, is we are very keen to get a formally vetted se murad ye hai ki somebody should see it to make sure that all the names and contacts are kosher, that we are getting the right contacts in North America of people who should be research active. That means they are holding research grants, they have programs that they can offer something with some concrete backbone. Second, that they have the time. So there's probably little point in connecting us with extremely busy researchers who don't have the time. And I know of several who are very busy and very well-meaning, but just don't have the time to give. So give us the names, as many as you like. And I will take it upon myself with Zain to make sure that they become part of the Higher Education Commission's effort with the diaspora, at least around research. And then at some stage, we should hold a larger webinar or a workshop with those people and some of us from not just the HEC and the panel, but to maybe invite some people from the universities, the rectors or directors of research, and just brainstorm around how we can do better. And from that will emerge ideas for funding, financing. I mean, I am convinced, I've been running research projects in Pakistan for 3 decades. I can tell you that if you have a good idea, you will find the funding. I mean, funding has never been a constraint. I mean, I run portfolios in north of $60–70 million at a time. And that is possible from within Pakistan. And it's not just because it's Aga Khan or any other university. There are many other universities who have done very well. HSA is an example. LUMS is another example. So ye possible hoga. Agar aap isko dekhen, so that will be very concrete outcome from today's session. Marine has asked a very important question on metrics for research. So what are the metrics that we should look at? And is the HEC looking at its projects in terms of impact? So as Zain said, yes, there is an idea to look at impact assessment. But frankly, mera khayal mein, post hoc impact assessment or post facto, jiska shuru mein plan na kiya gaya ho, is always problematic because you neither have baselines, neither do you have those indicators agreed upon with the investigators at the beginning. So it is something that we probably need to do more prospectively than retrospectively. It's very easy to go back and say कि जे 11 billion जो spend हुए हैं HEC से, इसके नतीजा कहाँ नजर आ रहे हैं? But the reason for that is that many of these research projects are small, and they're based on capacity development and infrastructure creation within universities. So अगर उन projects का एक outcome सिर्फ ये था कि 4 लोग train हो गए HPLC machine चलाने में या gene script चलाने में, so that's also a good outcome. But I think much better would be to develop parameters going forwards because research is going to enhance. I know that at the NIH and with the Institute for Health Research, that's exactly what we are going to do, is to establish a baseline and then say, going forwards, kya karna hai? What are we going to do in diagnostics, in surveillance, and what have you. One final thing that I will say to you, and then I'm afraid I have to leave, is that, please remember that particularly is Hukumat mein, there is enormous effort to link the diaspora, people outside Pakistan, and I'm, one of them who have 1 foot here and 1 foot there, back to the mother country. खास तौर पे वो लोग जो interested हैं. और इसमें मेरा अपना मुशाहिदा एक्सपीरियंस ये रहा है कि अगर आपने 1 कदम बढ़ाया तो अगलों ने 2 कदम बढ़ाए. और इसमें अब आसानियां पैदा हो रही हैं, इसमें मुश्किलात नहीं है. आहिस्ता आहिस्ता दीगर सेक्टर्स में भी ranging from voting to opening bank accounts to operating them. Today I heard that even biometrics, requirement has also been dispensed by the state bank in terms of opening and operating accounts. So ये सारी चीजें जो हैं, they are principally to make it easier for the Pakistani family to connect to each other. अब इसमें ताली दोनों हाथों से बजती है. So especially जो हम में से बाहर बैठे हुए हैं, who are better resourced, privileged, safer, and perhaps in a sense somewhat removed from the day-to-day challenges, the onus is upon us at times to also reach out with some ideas, is to reach out with some concrete things that can help and support organizations like HEC that is well-meaning but will do with additional capacity. So agar ispe kuch aap apna merit dekh sake कि what is it that can be done concretely, I think you will make a huge impact. I'm a great fan of APPNA from a long time, from the time that it first started its rural projects in Pakistan. I think there is an enormous opportunity for connecting with the motherland and also with doing a few things, but a few good things. So iske saath shayad and colleagues Uzair मैं इजाजत लूंगा. I have to join something else, but thank you very much for inviting me. And Zain, fantastic talk. Thank you very much again.
Thank you very much. Thank you very much.
Thank you. Thank you very much.
So thank you very much, Zain-ul-Abdin. Dr. Zain-ul-Abdin, it was a very thought-provoking insight about the HEC. So before we are apart, we should formally thank to all the participants for their passionate listening and being made themselves available post. Generally people are relatively more busy in a lot of other things. Just one question to you from my side. As you know, that some of the key issues in Pakistan, these are the public health good. We start the discussion with the vaccine. And the capacity is one of the key issue. Maybe HEC with the Pakistan Medical Commission can create something like vaccinology. I think that is a specialty which is so far not been there. With the Health Services Academy or any public or private university, that is really a missing link. If you look at the impact from the food security, discussing the animal vaccine, the poultry vaccine, the human vaccine, and their magnitude and impact, that is really huge, unbelievable. If I share with you the total figure, I think that is one of the largest initiative. And we are importing all poultry vaccine, we are importing a lot of veterinary vaccine, and now we have just started just the filling of the COVID vaccine, because time and again we have to ask the people from China or other countries really to come forward and train the people, because as such, there is no facility, there is no degree, there is no diploma, nothing of this sort. So if it should be initiated from the HEC with a collaboration with the Pakistan Medical Commission, really, that at any level, we need to introduce on war footing basis, because we are already too late. Time in and time out, our neighboring countries, they are becoming the hub of vaccine production in the world. And all the companies, they are so eager really to have their manufacturing facility settled in that countries. Really, I read today about the Pfizer that they are going to see the manufacturing capacity in India. Same stand true for Novavax, Johnson and you name it really, and everybody. So we are a neighboring country. We have a reasonable infrastructure, but the only missing thing, a serious capacity issue, which we must focus. So through you, my request would be really see if there is any way we can do something in that regard. So that is
Thank
really
you.
request to you.
Yeah, I think that's an excellent suggestion. I just inform you that
Thank you.
in one of the projects that we have funded in the GCF program last year, actually, it is about developing a vaccine capability for tick-borne diseases for bovines, actually. So, of course, it's a small step towards that direction, actually. But hopefully, we'll be able to fund more of similar projects for other vaccines as well, actually. And of course, now since Dr. Bhutta is going to lead the NIH initiative as well, actually. So we'll be very much working closely with him, actually, to fund these kinds of major initiatives as well, actually.
One just last suggestion. When you send the project for assessment, there should be some liaison between the assessor, because at times there is a limited capacity in one specialty. So from the one institute, there was a project about doing some research about the rabies vaccine. And the rabies vaccine is a critical factor in Pakistan. But I came to know that they could not succeed in getting the grant because of the input from some of the assessor. So we need to review, debrief after that. Their concern from the assessor, what they feel is really missing in this thing, and that is going to be a very nice feedback or input, which is really missing at this point in time. And we need to promote it, because information flow is in a loop. It's not one way or unidirectional. So I thought this is the appropriate platform that I should convey this request to you. And thank you very much. I think we have already crossed a lot of
Thank
time.
you. Yeah. Thank you, Zair. We cross. Then thank you very much. Always, you've been very kind. And
Yeah.
I will also send you. I think I will delegate it to Mustafa to create the list of health diaspora actively, like Dr. Zulfikar said, actively researching and also have time. So we'll share with you as well as Dr. Bhutta. That I think that is a very good thing that have come out of this webinar today. That's a great action item. So I love action, and if there's no action item after the webinar, I think you know, in that respect, this was
I think I saw some messages on the chat box about sharing my slides actually. So I think I've already shared it with Walid. So feel free to send it around actually if somebody wants to take a look at it.
Thank you. We really appreciate all the attendees, all the panelists to be here with us on this Saturday. We'll see you next week with a new topic. Please keep attending this landscape of research and healthcare innovation in Pakistan. And Assalamu alaikum and Eid Mubarak again. Thank you. Assalamu alaikum.
Thank you.
Thank you, everybody.